I've spent the last few years working for one of the largest Shockwave clinics in North America, and I've learned a thing or two about the power and untapped potential of regenerative medicine. But the march towards a future where sickness is healed from its root cause is challenged by the influence of big pharma and their deep pockets. So now we're forced to answer questions like, how do we get rid of joint pain, take back our performance in the bedroom, and heal diseases from the inside out without band-aid medications or negative side effects? This show will give you the answers. Follow along as I interview the world's top experts and doctors and how they transform their lives and their patients' lives using the newest advances in biotechnology. I'm your host, Austin James Wolff, and you're listening to Modern Biotech Radio. Hey, what's going on, Modern Biotech Pioneers? Welcome back to another episode of Clinical Studies Made Simple. Okay, so today we're talking about cellulite again because I want to sort of go over as many clinical studies as possible about shockwave therapy for cellulite. As humanly possible because it works, and I want to break down the science of why it works. A lot of people think that, when you introduce this new kind of therapy, they don't believe it at first until, of course, they see the clinical studies and the before and after photos, which are incredible. Just to let you guys know, a little brief disclaimer, shockwave therapy is not a cure for cellulite. There will probably never be a cure for cellulite because it increases with aging. It's partly due to genetics. So until we can change our genetic code, until we have that sort of therapy in the future, cellulite will be a problem until we can turn our genes on and off at will, as well as affect our diet and exercise and optimize our hormones. Okay, so but until that point, there are other treatments for cellulite, and one of the most effective ones, the American Association of Dermatology has called acoustic wave therapy one of the most effective treatments for cellulite. And the good news is there is no negative side effects with shockwave therapy. So I want to go over this clinical study with you. This clinical study is actually different from most. Most clinical studies have a sample size, and they give one of them shockwave therapy, one of them a placebo. But this one was quite different. They only had one patient, and they went deep with this patient. They wanted to know everything about this one patient as they used shockwave therapy on her cellulite. So that is what it is. This was published in 2008 in the Clinical Interventions in Aging Journal. And the details of the study I'll share with you right now. It was one woman. She was 50 years old, and she got 4 shockwave treatments done in a matter of 21 days. So almost one a week. And what they did was, after she got her treatment, what they did was they took a little sample of her skin, and this is what was interesting. No damage to the treated... Excuse me. I'll read this direct. This is directly from the study. So for my podcasters, if you're listening to me right now, I'm reading this directly after the study. My YouTubers, you can just read along with me. Here it is. Directly after the last ESW application, skin samples were taken for histopathological analysis from the treated and from the contralateral untreated area of skin with cellulite. This is important. No damage to the treated skin tissue, in particular no mechanical destruction to the subcutaneous fat, could be demonstrated by histopathological analysis. However, an astounding induction of neocollageno and neoelastinogenesis within the scaffolding fabric of the dermis and subcutis was observed. The dermis increased in thickness as well as the scaffolding within the subcutaneous fat tissue. Optimization of critical application parameters may turn ESW, shockwave therapy, into a non-invasive cellulite therapy. This was done in 2008. We're 12 years into this now, and tons of studies have come out, and now it's becoming a regular treatment for cellulite, which is great. It's being used in tons of doctors and dermatologists' offices. But that one part of the study I wanted to go deep into, it mentioned that there was an astounding induction of neocollageno and neoelastinogenesis. What the hell does that even mean, right? When I first read that, I was like, what? So I went even deeper. So neocollagenesis is the formation of new collagen fibers. Now, what is collagen? If you haven't heard of collagen before, it's one of the most important things in our body. It creates what's known as tensile strength. So it's the main component of cartilage, tendons, and most importantly, your skin. So when people wrinkle as they age, it's because they're losing collagen in their skin. Theoretically, if you had enough collagen in your skin, you would never wrinkle as you aged, right? Theoretically, if you had more collagen buildup in your joints, you would never have joint pain from cartilage, a lack of cartilage. If you had enough collagen there, you never feel joint pain from a lack of cartilage. So that's what collagen is, right? It's very good for the skin. It makes it like a baby's skin has so much collagen in it. It's insane. So collagen is what makes the skin look fresh, revived, healthy. And then shockwave therapy also causes what's known as neocollagenesis or neoelastogenesis. The science community uses both terms interchangeably. Neoelastogenesis is the formation of new elastin fibers. Elastin creates elasticity to the skin, so it allows whatever it's in to be able to stretch and return back again. So, for example, when you smile, right, you can smile. It kind of stretches your face. You're using those elastin fibers, right? Or when you make facial expressions, those are the elastin fibers at work. And then the collagen makes your skin healthy and full, right? So we need collagen, we need elastin, we need those two things. Interestingly enough, shockwave therapy induces neocollagenesis and neoelastinogenesis. Try saying that 3 times fast. So basically, shockwave therapy, what they're saying is, helps create new collagen, helps create new elastin. This is what makes the skin over the cellulite. This is what makes the treated area of cellulite appear smoother. This is what can smooth the skin. So I won't bother you with most of the scientific details of the study. They go deep into the science. That isn't my purpose of today's episode. I go deep into science into other episodes, and I've done it multiple times this morning already, so you can look up earlier episodes if you want to go deep into the science. But one part in particular that jumped out to me is this study mentions neocollagenesis and neoelastinogenesis, and the other studies don't, which is interesting. Maybe they didn't take skin samples. But this was quite interesting because other studies on shockwave therapy for cellulite mention, fat cell apoptosis, so it kills the fat cells, right? And then it increases lymph angiogenesis, so it helps your lymph system, your lymph vessels. It helps you grow more lymph vessels to be able to take out the waste from the area of treatment, so it can kill those fat cells. And then your lymph system needs to drain them out so it can be burned by your body. And it can also grow new blood vessels, right? So that's in most of the studies, but most of them didn't mention the neocollagenesis and neoelastinogenesis. I'm assuming because they didn't take skin samples. So that was really interesting because it can help make that skin look smoother and younger again. So that really jumped out to me. Again, no damage to the tissue was seen. Reduction in cellulite was also seen. So that was awesome. That's it as far as the study goes. I could read off this conclusion to you word for word, but I've done that in other videos as well. All you need to know is, yes, cellulite works. They're still trying to find out which parameters of the treatment need to be refined. Like, okay, what's our energy output? How many treatments should you do? What else should you do in combination with it, right? That's all. But the studies prove it works. The American Association of Dermatology, they've said, yeah, no, this is great, this works, and there's no negative side effects. So that's it, guys. It works. If you want to get treatment for cellulite using shockwave therapy with no negative side effects, just look up cellulite shockwave treatment near me. If you live in Southern California, you can come see us at the Novus Center, and we may or may not be making a home use device that's affordable for everybody. Stay tuned on that one, guys. And if you have any questions, please leave a review on iTunes and put your question there. We'll answer it on the show. Thanks, guys. Want to see what the top experts have to say behind the scenes? Just go to modernbiotechradio.com and you'll get instant access to every behind-the-scenes interview for free. Now, these interviews are not for the public, so please don't share. But if you'd like to pull back the curtain with me and learn what secrets they reveal, just go to modernbiotechradio.com and get instant access to these interviews for free. Again, that's modernbiotechradio.com. If you'd like to learn the best kept secrets that they can't share publicly but allowed me to share in private, just go to modernbiotechradio.com and get instant access to all of these interviews completely free. I'll see you there. And now for our lovely legal and medical disclaimer. While I make every effort to broadcast correct information, I am still learning. I will double check all my facts, but realize that medicine is a constantly changing science and art. One doctor may have a different way of doing things from another. I'm simply presenting my views that are as evidence-based as possible. I welcome any comments, suggestions, or correction of errors. I take no money from drug companies. By listening to this podcast or reading this blog or watching this YouTube video, you agree to not use this podcast, blog, or video as medical advice to treat any medical condition in either yourself or others, including, but not limited to, patients that you are treating. Consult your own physician for any medical issues that you may be having. This entire disclaimer also applies to any guests or contributors to the podcast, blog, or YouTube account. Under no circumstances shall Austin Wolff, Launch Medical, Moonpool LLC, or the Novus Anti-Aging Center, or any guests or contributors, or any employees, associates, or affiliates of Launch Medical, Moonpool LLC, or the Novus Anti-Aging Center be responsible for damages arising from use of the podcast, blog, or video. This blog or podcast or video should not be used in any legal capacity whatsoever, including but not limited to establishing standard of care in a legal sense or as a basis for expert witness testimony. No guarantee is given regarding the accuracy of any statements or opinions made on the podcast, blog, or video. This website, blog, podcast, and video are all HIPAA compliant. While you may give your email address to subscribe to the website posts or to post information on the website or blog, I will never share your email address or contact information with any third parties without your explicit permission. One more note. I have no idea what I'm talking about, and people that listen to me have a 100% mortality rate. This is true. Think about it. So please, consult your physician for any medical advice because this blog post, podcast, and YouTube video or any other video are meant for educational and entertainment purposes only.